Dr. Rosenman is a professor of medicine and chief of the Division of Occupational and Environmental Medicine at Michigan State University. Dr. Rosenman is a board-certified in internal medicine and occupational medicine, and he received his medical degree from the New York Medical College in 1975. He is a fellow of the American College of Epidemiology and the American College of Preventative Medicine. He also has published approximately 145 articles on occupational and environmental disease.
Thank you for the opportunity to talk about the system to keep track of occupational injuries and illnesses in the United States. My name is Kenneth Rosenman. I'm a physician and epidemiologist who has studied and written about surveillance systems for the last 25 years. Recent newspaper articles have once again, and I really want to emphasize once again, highlighted shortcomings in the nation's efforts to track work-related conditions. A basic tenet for preventing and minimizing any disease is to have a system that provides accurate information on both the frequency and circumstances associated with those conditions. Such a system is essential in order to determine how much resources to allocate, how to target interventions, to evaluate those interventions, and if necessary, to redirect the interventions. The current U.S. system to count injuries, occupational injuries, and illnesses in the United States does not provide this necessary information. In 1987, the National Academy of Sciences issued a report, Counting Injuries and Illnesses in the Workplace, Proposals for a Better System. As a consequence of that report and the deficiencies noted in the system, some changes were made. The most pronounced change was how acute work traumatic fatalities were counted. Somebody dying because of a trench collapse, being electrocuted, falling off a scaffold. As a consequence of these changes made in the tracking system, the number of work-related deaths doubled in the first year of the new system. So they doubled. This 100% increase in the number of deaths was not due to a sudden increase in the hazards of work, but rather to the implementation of a new and accurate system to count these deaths. No such changes were made how work-related diseases such as lead poisoning, silicosis, work-related asthma were counted, or how non-fatal injuries such as amputations, burns, lacerations, or fractures were counted. In the last 20 years, I and others have researched and published multiple studies that the current system provides an inaccurate count of work-related illnesses and non-fatal injuries. There is no disagreement in the medical literature that an undercount exists, and that this undercount is significant. Attached to my statement are 15 references from the medical literature. I want to quickly summarize the work of 4 investigators. First, Dr. Lay from the University of California in Davis, whose work shows that the current system misses 33 to 69% of all non-fatal work-related injuries. He calculated using the current system that work-related injuries and illnesses cost the United States $170 billion a year, which is 5 times the cost of HIV/AIDS and 3 times the cost of Alzheimer's disease. Next, Doctors Bowden and Ozanoff from Boston University, who have shown in the 6 states of Minnesota, New Mexico, Oregon, Washington, West Virginia, and Wisconsin that the current system misses up to 50% of non-fatal work-related injuries and illnesses. The next, Drs. Friedman and Frost from the University of Illinois in Chicago, who have shown that reductions in the non-fatal work-related injuries reported over the last decade are not due to improvements in the workplace conditions, but rather reductions in OSHA's enforcement of record-keeping rules and changes by OSHA in the definition of work-related injuries. They actually showed that 83% of the decrease in the last decade were due to these record changes by OSHA and not due to any reduction in actual injuries and illnesses. So that even one would hope if the underreporting was consistent that one could at least look at trends, but their data says no. My work with colleagues from Michigan State University that show the current system misses 66% of work-related injuries and illnesses in Michigan. And we found that this undercount occurred across all different types of industries and for both injuries and illnesses. And in a separate study, we showed that the current system missed 1/3 of amputations, and a similar study in Minnesota also showed those results. So in summary, The current system to count work-related injuries and illnesses has been repeatedly studied and shown by researchers to have a large undercount. Expert panels that have reviewed the current system have reached a similar conclusion. The current system for non-fatal injuries and occupational illnesses relies solely on employer reporting, and the previous speaker spoke to some of the problems with employer reporting. And our current system ignores the large number of databases that are not dependent on employer coverage or compliance with OSHA record keeping. These include hospital and emergency room databases, poison control center data, state laboratory reporting regulations, state occupational disease reporting laws, and workers' compensation. What is needed is a comprehensive system for work-related illnesses and non-fatal injuries that makes use of available, non-employer-based data systems analogous to what now exists for traumatic work-related fatalities. Currently, the annual number of work-related illnesses and injuries reported is based on a statistical extrapolation from a relatively small sample of employers, about 150 to 200,000 out of our 7 million employers. Statistical extrapolation from a much wider range of medical data systems is essential if we are to have an accurate tracking system that will provide the basic numbers needed for targeting the effort to reduce these injuries and illnesses. Thank you.